to turn to medication, and maybe if they're lucky, they'll get some physical therapy, or they're just going to ignore the problem and it's going to get worse and turn into surgery or opioid abuse. Or, I mean, these are the things that happen. I mean, the aspirin kills more people now than alcohol from liver disease. That's, you know, from liver failure. And so these are huge problems. And anyway, the point is that we just need to be aware that we lack a little bit of the credibility that the medical profession has. And so what we're going to talk about today is, how do we build trust with the patient? How do we present our recommendations in a way that instills confidence and makes them trust us, and so they follow through with their treatment program, which is really what gives us the best outcome possible with the patient. Most of my failures in my career weren't with the chiropractic care that I provided, but were patients who discontinued care or didn't follow through with my recommendations and ended up having surgery or getting really bad results, or just living with their pain for decades. Okay, so that's what we're going to talk about today. The big thing to remember when we start talking about the day one is the one thing we're trying to accomplish on day one is we're trying to build trust. We've basically created a formula where there's a dozen different little things you can do that you have to do anyway. It's all information that you need to gather, but we're going to present it in a way that creates the familiarity and the trust and the good feelings associated with it. So, for example, the very first thing we want you to say when they come into the office was, you know, how'd you hear about our office? Or who referred you to us? Okay. And the patient half the time is going to say, well, Dr. So-and-so referred me over, you know, Dr. Gamby sent me over. And your response is, oh, I love Dr. Gamby, he's a fantastic doctor. If they say, oh, a patient referred him over, and you know that patient, say, oh, you know, because you'll start getting, them. Yeah, you say, oh, I love them, they're fantastic. Oh, we appreciate that. We get most of our businesses from referrals, so we always appreciate it when patients recommend us to other people. And the goal with this is to bond with them. So if I say, hey, Chris, do you know Amanda, the naturopath? And you're like, I know Amanda. There's an instant bond. It creates a little, neurotransmitter release in the brain that gives you a little warm fuzzy. And you might not even be aware of it. You just know, oh, I like this person. So that's the first step, is you're trying to get that connection, if at all possible. If not, if they say, oh, I Google review, or I saw an ad in the newspaper, you move on. But you're always trying to get one brief connection. Oh, I saw your tattoo, you know, you're in a motorcycle gang. I love motorcycles. Who cares? This should only take 1 minute. We're not going to spend 15 minutes trying to find a connection. If there's a connection and we can make it and say something positive, great, and then move on. Okay?
Sure.
Then we go straight in. The other thing we're going to do to build trust is we're going to go straight into the main complaint. So now, half the time, if they're a referral from another chiropractor, you're already going to know why they're there. The chiropractor who referred them should have told you in advance. Here's the condition. I think they have a torn rotator cuff. I think it's this one. And I need to know if PRP is a good possibility for them. In fact, I really want to do PRP, and I just need you to make sure it's okay. And so you'll already walk in. And so the patient comes in and say, okay. And so really, you're just going to confirm the main complaint and say, okay, I guess you're here because you got a torn rotator. And they're going to say, you know, yes. And then your job is to go through and do your own exam. Now, if they haven't been in, then you would just, of course, ask, what's your main complaint? What brings you to the office? What can I help you with? And it's going to be an open-ended question. And they'll tell you what it is, and then your job is to go through the standard protocols. Now, do you already have a standard protocol for asking those questions?
Yeah, I mean, it looks very similar to what yours is.
Yeah,
It's the same. It's what we learn in school. Just, where is it? Can you show me? Point to it.
yeah.
How bad is it? Can you rate it on a scale of 0 to 10?
Mhm.
How long has it been going on? Does it bother you all the time, or is it intermittent? Have you done anything for it? And then, from there we start the physical exam.
Okay. Great. So all of that, yeah, just stick to that. And we've got it actually listed out just to be thorough and clean, and we go through ways to do that. Now, when you're done with that, the only thing they're going to add two things to it. One is what we call an anchor. And the anchor, a lot of these patients have chronic or degenerative diseases. And we know that with chronic or degenerative diseases, you typically don't have any symptoms until the last 5%. So, if you've got melanoma, you don't have any symptoms, just a little spot on your skin. And if you ignore it for 2, 4, 5, 6 years, it eventually reaches your bloodstream and then spreads throughout your body and kills you. But you don't have any symptoms until it's finally spread to all the different parts of your body and starts to cause problems in those areas. And by then it's too late. And the same thing goes with, I hurt my knee in high school, but it didn't bother me till I was in my 40s, because I was young. So what you have to do sometimes with the patient is they'll come in and say, yeah, my shoulder started hurting, or I was out working and then my shoulder started hurting and it's been 2 weeks and it's not getting any better. It's been 2 months. Well, if they think they have a 2-week-old problem or a 2-month-old problem, they probably don't realize that they injured it playing baseball back in Little League, and that all the cartilages wore away and one of their ligaments is tore. Because they said, I was just working in the yard. This is a small problem. I don't understand. And so it's really important that you include, you kind of go back in time. In other words, you got to kind of wake them up. You're going to educate them a little bit and help them understand that this could be an old degenerative problem. Otherwise, what happens when you come back the next day and go, okay, the ultrasound and the x-ray showed that you have stage 4 degenerative, osteoarthritis in your shoulder and it's falling apart. And that's going to shock them, and they're going to be like, well, that doesn't make any sense. It never started hurting until 2 months ago. And you're trying to tell me this is a 30-year-old problem based on the x-rays. But if you were able to, on the day one, point out to them that it's unusual to have a shoulder problem for 2 months for no reason or from working in the yard, and it's more likely, and you predicted to them, hey, it looks like this could be an old injury from 30 years ago that's decayed over time. And then when you tell them the next day, hey, look at your x-rays, this is definitely from that injury you had in Little League. 2 things happen. Number one, you look really freaking smart because you predicted to them the day before that this is actually an old injury that degenerated over time. And you said it was, and now you have proof of it. So you look really smart, and you don't want to miss that opportunity to look smart. I never miss an opportunity to look smart. I'm always trying to do that. Okay. So it's real important you put that on your list to do the anchor. And then the second thing that it does is it increases the severity in their mind. It helps them understand. In other words, a patient's not going to go, I need stem cells and PRP and 8 weeks of rehab, and I got to do all these exercises, and I got to change my diet, and I got to, do all this work and money and time for a minor problem that just showed up 2 months ago. And really, why can't I just rest it, put it in a brace, and take some Advil?
Right.
They're not going to do that for a minor gardening injury that's 2 months old, but they will for a 20-year-old injury. So you got to really emphasize these points, okay?
That sounds good.
Okay, just bringing your awareness to it. Okay, that's the anchor. It's an absolutely critical part. Now, I'm going to talk about the way we want you to present. So you met the person, you know, you bonded with them a little bit, found something in common, then you went through and you expertly asked a whole bunch of questions about their condition. And now you should have a working diagnosis. In fact, 95% of the time, after I've just asked a few questions about their symptoms, I've got a really good idea of what the diagnosis is, right? After you've got the history and you're ready to do the exam, before you do the exam, it's very important that you stop for a second and restate back to the patient exactly what they just told you. So it would go something like this. It would go, hey, Mary, I want to just make sure that I've got all the details of your story correct. So you told me that 2 months ago you were out in the yard working, and as you were digging, you felt a tiny pain in your shoulder, and then 3 hours later, it started to turn into an ache. And later that night, when you were sleeping, it woke you up, and it's been aching ever since. On a scale of 1 to 10, your pain is a 3. But in the middle of the night, it actually got up to an 8. You had to get up and take some medication for it. You still couldn't go back to sleep. And it's been aching ever since. It hurts when you reach forward. The pain can be sharp, but it's often more of a tiny dull that's there all the time. As long as you hold it in this position, it doesn't hurt. But anytime you have to reach behind you, it causes more pain. And the biggest issue is that it's bothering you when you sleep. Well, it does stop you from gardening and doing the dishes. Do I have a clear understanding of your problem, Mary? The summary is super critical because number one, it lets the patient know I'm listening and I'm paying very close attention to your problem. So this is going to give them a very nice warm fuzzy to go, wow, I had no idea. This guy's really paying attention. And the most common phrase you get whenever you do this kind of a summarize, if you do it right, and remember, you're trying to use the exact same words they used and add as many little details as you can. And you're actually trying to do it as fast as you can. You want, just the way I did, you want to go, boop, 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 boop. This is just get it all out as fast as you can, as many details. And they just, the most common phrase I get after I do that is they look at me and they go, wow, you know my problem better than I do. Because a lot of those details they hadn't even paid attention to, and you woke them up to it and they go, wow, that was really cool. So this does a couple of things. Number one, it builds enormous amounts of trust because they go, I've got a doctor who listens to me. Number two, it says, I know what I'm doing because of the way you summarized it. And number three, there's nothing worse than later on the patient comes back and starts talking about all their symptoms and their problems, because they don't think you listened the first time and they want to reassure you. This tells them, I know what I'm talking about. You don't have to bring it up anymore. And I don't know if you've ever had that, but I've had that before where patients keep reminding me what their symptoms are. It's because they didn't trust me. And now I go, I know what's going on. You don't need to tell me. So actually they never say it because I avoid that awkward situation where they keep bringing things up. So, but the main reason is you want to build trust with that summary. Okay.
Okay.
Now, I actually forgot the most important part. So the summary is really critical. And when you're done with the summary, you look them in the eye and you want a verbal confirmation that you got it right. So after you summarize it all, you go, Mary, do I have a clear understanding of your problem? And most of the time they'll look at you and be like, yes, you get it. And if they don't, they may throw in, oh, by the way, my arm goes numb and tingles. Oh, well, that's, so it gives them a chance to fill in any other details. You want all the details out. And so, oh, your arm goes numb and tingle, boom, boom, tell me a little more. Okay, anything else? Anything else? Anything else? Until they can't think of anything and then, no, you've got it. You go, great, thank you.